report things that you're going to see on most of your patients. You're going to see antihypertensives. You're going to, you're going to see miscellaneous things like Winoxin and antibiotics and stuff like that. One thing I do want to mention about iron, we give IV Ferlicit in the dialysis unit, and even the movie mentioned that hemodialysis patients tend to not tolerate oral iron very well. For some reason, PD patients do tolerate it. So anyway, okay, antihypertensives, and this is what we're going to spend, well, there's a lot of categories here, okay. The first thing we're going to talk about is ACE inhibitors, and this includes things like Altase, lisinopril, Lovatensin, Mavic, and Zestril. Okay, and how ACE inhibitors work is they block the enzyme that causes the blood vessels to narrow. So, what's the opposite of narrow? Relaxed. If the blood vessels aren't caused to be narrow, they're more relaxed. And when the blood vessels relax, then the blood pressure goes down. Also, decreased amount of sodium in the body causes blood pressure to go down. ACE inhibitors are thought to be renoprotective. R-E-N-O, protective. Okay. They are thought to prevent or slow the progression of renal failure in the person who's compromised. Side effects include that persistent dry cough, increased creatinine, increased potassium, rash, angioedema. Important patient teaching. The medication might cause might cause lightheadedness. It should not be taken or stopped abruptly. You don't want to stop any of these medications abruptly. And diabetics in particular may have low blood sugar problems. Now, when we talk about these side effects, and we've mentioned several for the different medications and stuff, a lot of these patients are very, what do I want to say, prone to follow the power of suggestion. If you say, this may cause this, or this, dizziness, drowsiness, nausea, vomiting, if you tell a patient this may cause this, there are some patients for whom all it takes is the power of suggestion. It has nothing to do with the medication. So we don't really emphasize that a lot. However, there are some things you should mention. For example, with ACE inhibitors, make the patient aware that it might cause lightheadedness, because if they're driving or operating heavy machinery or something, until they get used to the medication, they might want to take extra precautions. So that's something you would. And side effects should always be reported. You should tell them if they have any side effects or any problems since they start the medication, to be sure and let you know so you can discuss it with the doc. Okay, our next